Urban areas worldwide face escalating vulnerability to multiple interconnected hazards, including the intensifying impacts of climate change, recurring natural disasters, deepening socio-economic inequalities, and persistent infrastructure deficiencies. Geographic information systems have emerged as indispensable analytical tools that enable researchers, urban planners, and policymakers to systematically map and analyze these urban vulnerabilities. By spatially integrating diverse datasets representing exposure, sensitivity, and adaptive capacity, GIS facilitates the identification of at-risk populations and the strategic prioritization of intervention measures. Vulnerability mapping has become a critical component of comprehensive disaster risk reduction strategies and sustainable urban planning initiatives. Through the spatialization of vulnerability indicators, decision-makers gain the ability to visualize geographic hotspots where multiple risk factors converge, thereby enabling more targeted and efficient resource allocation and evidence-based policy interventions. Understanding urban vulnerability requires a robust conceptual framework that acknowledges its multidimensional nature. The Intergovernmental Panel on Climate Change defines vulnerability as the propensity or predisposition to be adversely affected, encompassing both susceptibility to harm and the lack of capacity to cope and adapt. In urban systems, vulnerability represents the dynamic interaction of three fundamental components. Exposure refers to the presence of people, livelihoods, infrastructure, and economic assets in locations that could be adversely affected by hazardous events. Sensitivity describes the degree to which a system or population experiences adverse effects from hazardous events, influenced by factors such as demographic composition, health status, poverty levels, and housing quality. Adaptive capacity represents the ability of systems, institutions, and individuals to adjust to potential damage, capitalize on opportunities, or effectively respond to consequences. The complex interplay among these three dimensions ultimately determines the overall vulnerability profile of urban communities, revealing where climate risks intersect with poverty, age demographics, mobility constraints, and infrastructure access patterns. Urban vulnerability encompasses both social and physical dimensions that must be comprehensively addressed in vulnerability assessments. Social vulnerability refers to the inherent characteristics of individuals and communities that fundamentally influence their capacity to anticipate, cope with, resist, and recover from hazardous events. Key social vulnerability factors encompass socio-economic status, demographic composition, household structure, access to critical resources, social capital networks, institutional capacity, educational attainment levels, and language barriers that may impede access to emergency information and services. Populations characterized by limited financial resources, elderly individuals, children, persons with disabilities, ethnic minorities, and recent immigrants frequently exhibit heightened social vulnerability due to constrained access to information, resources, and participation in decision-making processes. Physical vulnerability pertains to the built environment's susceptibility to damage from various hazards, encompassing building quality and age, infrastructure resilience, land use patterns, environmental degradation, adequacy of drainage systems, location within designated hazard zones, construction materials used, and building density patterns. The critical interaction between social and physical vulnerabilities creates compound risks, as socially disadvantaged populations often reside in physically vulnerable locations characterized by substandard housing and limited access to protective infrastructure. Effective vulnerability mapping fundamentally depends on accessing and integrating diverse data sources that capture the multidimensional nature of urban vulnerability. Census data provides essential demographic and socio-economic information aggregated at various administrative levels, offering insights into population characteristics and household conditions. Remote sensing imagery enables comprehensive land cover classification, environmental monitoring, temperature measurements, and vegetation index calculations that reveal biophysical vulnerability patterns. Infrastructure maps document the spatial distribution of roads, utilities, and critical facilities, revealing accessibility patterns and service gaps. Hazard maps delineate exposure to specific threats including flood zones, seismic risk areas, and landslide-prone locations. Cadastral databases contain detailed property and land use records that inform assessments of building characteristics and land tenure patterns. Field surveys provide invaluable ground truth data and local knowledge that validate remotely sensed information and capture nuanced vulnerability factors not available in existing datasets. The strategic integration of these diverse data sources enables comprehensive vulnerability assessments that reflect both the biophysical and social dimensions of urban risk. Geographic information systems provide numerous sophisticated spatial analysis techniques for processing vulnerability data and generating meaningful assessments that inform decision-making. Weighted overlay analysis represents one of the most widely applied methods, enabling analysts to combine multiple raster layers representing different vulnerability indicators using predetermined weights to produce composite vulnerability scores. Spatial interpolation techniques, including inverse distance weighting, kriging, and spline methods, estimate vulnerability values at unsampled locations based on surrounding measurements, proving particularly valuable when working with point data or incomplete spatial coverage. Kernel density estimation identifies spatial concentration patterns of vulnerable populations or hazard events, effectively highlighting areas requiring priority attention from planners and emergency managers. Buffer analysis determines proximity relationships between vulnerable populations and both hazard sources and protective resources such as emergency facilities and evacuation centers. Network analysis assesses the accessibility of critical services and evaluates the adequacy of evacuation routes, revealing potential gaps in emergency response capacity that could compromise population safety during disaster events. Each of these techniques contributes unique analytical capabilities that, when appropriately combined, enable comprehensive vulnerability assessments. Composite vulnerability indices aggregate multiple indicators into single scores representing overall vulnerability levels, facilitating comparison across geographic units and communication with policymakers. The Social Vulnerability Index, developed by the Centers for Disease Control and Prevention, combines 16 social vulnerability variables across 4 domains: socioeconomic status, household composition and disability, minority status and language barriers, and housing and transportation characteristics. The SVI uses percentile ranking methodology, enabling standardized comparison across geographic scales from census tracts to counties. Developing composite indices requires attention to normalization methods that transform variables into a common domain, weighting schemes that assign relative importance to indicators, and aggregation methods that combine indicators through linear additive approaches, geometric means, or complex functional relationships. Research shows that methodological choices regarding indicator selection, normalization, aggregation, weighting, and classification significantly influence index outcomes, with weighting as a major contributor to uncertainty. Sensitivity and robustness analyses should be routinely conducted to prevent composite indicators from providing misleading information. The systematic workflow for vulnerability mapping comprises 6 essential phases that ensure methodological rigor and analytical reproducibility. First, data acquisition and quality control involves gathering diverse datasets from multiple sources, followed by rigorous validation procedures to identify and address errors, inconsistencies, and missing values that could compromise analytical integrity. Second, indicator selection and normalization requires careful identification of relevant vulnerability indicators based on conceptual frameworks and data availability, followed by standardization of variables measured on different scales to enable meaningful comparison and aggregation. Third, weight assignment employs expert input, stakeholder consultation, or statistical techniques such as principal component analysis to determine the relative importance of different vulnerability indicators in the composite assessment. Fourth, the combination of raster and vector layers through overlay operations integrates diverse spatial datasets representing different dimensions of vulnerability into a unified analytical framework. Fifth, calculation of composite vulnerability scores aggregates weighted indicators according to predetermined mathematical relationships, producing continuous or categorical vulnerability measures for each spatial unit. Sixth, map classification and visualization transforms complex vulnerability data into accessible cartographic representations that effectively communicate spatial patterns and support decision-making processes. Indicator normalization represents a critical methodological step that standardizes variables measured on different scales, thereby enabling meaningful comparison and aggregation across diverse vulnerability dimensions. Min-max scaling transforms values to a standardized 0-1 range using the formula x-min, max-min, preserving the original distribution shape while ensuring comparability across indicators. Z-score standardization converts values to standard deviation units using the formula x-mean, standard deviation, facilitating identification of extreme values and comparison across variables with different units and variances. Percentile ranking assigns relative positions within the data distribution on a 0-100 scale, providing an intuitive interpretation of where each observation falls within the overall distribution. The choice of normalization method significantly influences final vulnerability scores and should carefully consider indicator distributions, presence of outliers that may distort results, and the intended interpretation of results by end users. Additionally, indicator inversion may be required to ensure directional consistency, where higher normalized values consistently indicate greater vulnerability across all variables in the composite index. Transparent documentation of normalization procedures enables critical evaluation and replication of vulnerability assessments. Assigning weights to vulnerability indicators reflects value judgments about the relative importance of vulnerability dimensions. Equal weighting assigns identical importance to all indicators, offering simplicity and transparency but potentially overlooking differential indicator significance in contributing to overall vulnerability. Expert-based weighting incorporates professional judgment from specialists in disaster management, urban planning, public health, and climate science, capturing understanding of local contexts and hazard characteristics that may not be evident in statistical relationships. Stakeholder-driven approaches engage community members, emergency managers, and policymakers in weight determination through participatory methods such as surveys, Delphi techniques, or multi-criteria decision analysis workshops that build consensus around vulnerability priorities. Statistical weighting methods, particularly principal component analysis, derive weights empirically from data structure by identifying dimensions and reducing multicollinearity among indicators. PCA generates factor loadings representing indicator contributions to principal components, informing weight assignment in a data-driven manner. The analytic hierarchy process provides a framework for systematically comparing indicators and deriving weights based on pairwise comparisons. Each approach offers advantages, and sensitivity analysis testing alternative schemes assesses result robustness and identifies influential methodological choices. Effective visualization transforms complex continuous vulnerability data into accessible cartographic representations through appropriate classification schemes that group values into discrete categories. Research comparing classification approaches for epidemiological choropleth maps found that quantile methods, which ensure equal numbers of observations per class, produced the most accurate map reading results across diverse interpretation tasks. Natural breaks, Jenks classification identifies inherent clustering patterns in data distributions by minimizing within-class variance and maximizing between-class differences, thereby creating visually distinctive classes that reflect actual data structure. Equal intervals classification creates consistent class widths across the data range, facilitating intuitive interpretation when the full range of values holds substantive meaning. Standard deviations classification establishes class boundaries at specified distances from the mean, effectively showing variation patterns and highlighting extreme values. Risk-based classification schemes employing categories such as very high, high, moderate, low, and very low vulnerability facilitate intuitive interpretation and support risk communication with diverse audiences. While more sophisticated optimization algorithms exist for classification, research suggests that simpler quantile-based approaches often perform comparably or better for general map interpretation and facilitating comparisons across multiple maps in a series. Vulnerability mapping directly supports disaster risk management activities across all phases of the emergency management cycle, including preparedness, response, recovery, and mitigation. During preparedness planning, vulnerability maps systematically identify priority areas for deploying early warning systems, planning evacuation routes that account for population distribution and mobility constraints, siting emergency shelters in accessible locations near vulnerable populations, and targeting community education campaigns to populations with limited hazard awareness. Emergency response coordination utilizes near real-time vulnerability assessments to guide resource deployment decisions, ensuring first responders efficiently reach the most vulnerable populations during the critical initial hours following disaster onset. Recovery planning incorporates vulnerability considerations to avoid reconstruction patterns that perpetuate existing risks and to implement Build Back Better principles that strengthen community resilience through improved building standards, enhanced infrastructure, and addressed social inequalities. Risk mitigation strategies benefit from spatially explicit vulnerability information that guides land use regulations restricting development in high-hazard areas, building code enforcement targeting vulnerable structures, infrastructure upgrade prioritization, and nature-based solutions implementation in areas where ecological approaches can reduce exposure. Each of these applications demonstrates how vulnerability mapping translates technical analysis into concrete actions that reduce disaster risks faced by urban populations. Climate change fundamentally amplifies existing urban vulnerabilities while introducing novel risks that demand proactive adaptation measures informed by comprehensive vulnerability assessments. Urban heat island mitigation strategies employ vulnerability mapping to strategically prioritize multiple interventions, including green infrastructure installation in thermally vulnerable neighborhoods, cool pavement deployment in areas with high surface temperatures and vulnerable populations, and energy assistance programs targeting low-income households facing extreme heat exposure. Sea level rise vulnerability mapping informs coastal management decisions regarding infrastructure protection investments, managed retreat strategies, and equitable relocation planning for vulnerable coastal communities. Drought resilience planning increasingly relies on spatial vulnerability assessments to guide water conservation policies, alternative supply development prioritizing vulnerable areas, and support programs for populations with limited adaptive capacity. Flood management integrates vulnerability mapping with nature-based solutions planning, identifying locations where green infrastructure can simultaneously reduce flood exposure and address social vulnerability. Climate adaptation funding mechanisms at local, national, and international scales increasingly utilize vulnerability assessments to ensure limited resources reach communities facing the greatest climate risks while possessing the least adaptive capacity, thereby advancing environmental justice objectives in climate policy implementation. Vulnerability mapping serves as a powerful analytical tool for revealing environmental justice concerns by systematically documenting patterns of disproportionate hazard exposure and limited access to protective resources among marginalized communities. Spatial analysis techniques have identified patterns of environmental inequality in specific urban contexts, with research demonstrating how low-income neighborhoods and communities of color experience elevated pollution exposure compared to more affluent areas. Beyond pollution exposure, marginalized communities often face compounded challenges including inferior infrastructure quality, reduced access to green spaces and cooling resources, limited access to healthcare facilities, and inadequate emergency services, which collectively amplify their vulnerability to multiple hazards. Participatory vulnerability mapping represents an innovative approach that engages affected communities directly in data collection, analysis, and interpretation processes, ensuring integration of local knowledge and empowering residents to advocate for needed improvements in their neighborhoods. Community-based vulnerability assessments complement conventional technical analyses by capturing nuanced social dynamics, historical context, and place-based knowledge that conventional datasets overlook, resulting in more comprehensive and actionable vulnerability profiles. These equity-focused approaches ensure that vulnerability reduction efforts prioritize the needs of those facing the greatest risks while having the least resources to protect themselves. The Centers for Disease Control and Prevention's Social Vulnerability Index represents a standardized, nationally implemented vulnerability assessment adopted by emergency managers and urban planners across the United States. The SVI combines 16 census variables across 4 domains: socioeconomic status, poverty, unemployment, income, education, household composition and disability, age, disability status, single-parent households, minority status and language, racial, ethnic minority status, limited English proficiency, and housing and transportation, multi-unit housing, mobile homes, crowding, no vehicle access, group quarters. The index uses percentile ranking to calculate vulnerability scores for all U.S. Census tracts, enabling comparison across geographic contexts from rural communities to metropolitan areas. Several factors explain the SVI's adoption. Standardized methodology ensures consistency across jurisdictions, facilitating regional coordination. A publicly accessible web-based platform democratizes access to vulnerability data, enabling local agencies with limited technical capacity to incorporate social vulnerability into planning. Regular updates maintain assessment currency as demographics evolve. Integration into emergency management planning ensures vulnerability information influences operational decisions, resource allocation, and implementation rather than remaining academic. Urban heat vulnerability mapping in European cities exemplifies integrated biophysical and social vulnerability assessment for climate change adaptation. These initiatives integrate satellite-derived land surface temperature data revealing urban heat islands, demographic characteristics identifying vulnerable populations, building characteristics indicating thermal performance, and green space distribution showing access to cooling resources. Multi-temporal heatwave analysis examines vulnerability patterns across extreme heat events, revealing neighborhoods with elevated exposure and populations with limited adaptive capacity. Fine spatial resolution assessments at building or neighborhood scales enable precise targeting of adaptation interventions. European cities have used heat vulnerability mapping to guide placement of public cooling centers in neighborhoods with vulnerable populations, prioritize tree planting and green infrastructure investments in areas combining high temperatures with social vulnerability, and design outreach programs ensuring vulnerable populations receive heat warnings and access cooling resources. Success factors include comprehensive stakeholder engagement, integration of biophysical indicators, temperature, vegetation, and social indicators, age, income, health status, and vulnerability models, actionable recommendations linked to municipal programs and funding, and sustained political commitment to implementing measures. These case studies demonstrate how vulnerability assessments bridge technical analysis and concrete actions reducing climate risks for urban populations. Despite advances in GIS technology and vulnerability assessment methodologies, several challenges constrain urban vulnerability mapping. Technical challenges include data quality variations across contexts, with many developing countries lacking spatial datasets for vulnerability mapping. Temporal limitations constrain dynamic assessment, as analyses rely on static snapshots failing to capture evolving risk landscapes as populations, built environments, and climate conditions change. Scale dependencies affect vulnerability patterns, with assessments at different resolutions potentially yielding divergent conclusions regarding hotspot locations and affected populations. Methodological uncertainties stem from subjective decisions regarding indicator selection, normalization, weighting, classification, and aggregation, each significantly influencing vulnerability estimates. The modifiable aerial unit problem affects results when analysis units represent arbitrary administrative boundaries rather than meaningful social or environmental units. Validation challenges arise since vulnerability is difficult to measure directly, complicating accuracy assessment. Privacy concerns emerge when mapping vulnerability at fine resolutions, potentially stigmatizing communities. Implementation challenges include resource constraints limiting technical and financial capacity of local agencies, insufficient technical capacity among planning staff, difficulties ensuring vulnerability information influences planning decisions, limited political will to address contentious issues, and coordination challenges among agencies needing to collaborate across administrative boundaries. GIS techniques have transformed urban vulnerability assessment by enabling multivariable modeling that integrates social, economic, environmental, and physical indicators into spatial frameworks. GIS-based approaches reveal spatial patterns and relationships hidden in conventional analyses, supporting targeted interventions. However, technical sophistication must be matched by methodological transparency, including clear documentation of data sources, explicit assumptions, detailed analytical procedures, and acknowledgement of limitations. Without transparency, assessments risk becoming black boxes obscuring urban risk realities. Vulnerability mapping outputs must link to concrete actions including targeted resource allocation to high vulnerability areas, funding prioritizing vulnerable populations, zoning restricting development in high-hazard locations, and infrastructure investments reducing exposure or enhancing adaptive capacity. Success depends not on technical elegance or map aesthetics, but on catalyzing actions reducing risks for vulnerable populations. This demands collaboration among researchers developing methodologies, practitioners applying them, policymakers allocating resources, and community members providing context. As urban areas expand and climate change intensifies hazards, sophisticated, equity-focused vulnerability mapping becomes increasingly important for developing resilient and just cities.